What foods cause pain, swelling, and inflammation in your body? In this video, I'll explain 8 types of foods and why they do or don't cause these issues. You'll see there are many myths about this topic. Then I'll discuss 4 diseases that can be associated with swelling. Often people eat right, but still have a condition causing swelling. Until you treat the underlying issue, diet alone won't help and may even worsen. So, what are these foods? Number 1 is refined sugar. For 2 reasons I'll explain. By refined sugar, I mean adding it to coffee or eating sweetened foods. It's not about someone who occasionally eats sweets, like adding a bit of sugar at parties or events. Let's not take it to extremes. The issue is that a diet high in sugar and simple carbs can cause bloating. Firstly, glucose molecules attract water, leading to more bloating. Also, when you consume sugar like in sweet drinks or coffee, your body increases insulin to compensate. Insulin stimulates sodium and water reabsorption in the kidneys. Occasional indulgence won't make you chronically bloated or inflamed, as some trendy terms suggest. But if you're adding sugar to your diet daily, whether it's refined, brown, or demerara, you're more likely to experience swelling like in your legs, so cut sugar out of your diet completely. Trust me, you won't miss it. At first, it might feel odd since you're used to sweet foods, but it'll greatly benefit your health and you'll stop craving sugary foods. From experience, I used to add sugar to my coffee daily. I gradually cut back and now I can't even drink sweetened coffee. If you add even a little sugar to coffee now, I can't drink it. If you've had a similar experience, share in the comments to encourage others to cut out sugar too. It's really healthy. Sugar, just to connect the dots. Have you noticed when you eat sugar-free, you lose a lot of weight in the first few days? It's due to swelling. Without sugar-stimulating fluid retention, your body eliminates excess fluid. You didn't really lose fat in a day or two, it's just water retention. The opposite is also true. With a good diet, patients tell me they slip up, overdo sugar, and gain 2 or 3 kilos. It's not fat gain, but fluid buildup that shows on the scale. Number 2, and this is controversial, listen carefully to avoid misunderstanding. It's milk. Milk can cause inflammation if you have lactose intolerance or sensitivity to milk protein or lactose. It's not always diagnosed as lactose intolerance, but there's a sensitivity. If you don't have these issues, most people have no problem with milk. You can drink it without any concerns. I drink milk and enjoy it. It's a great source of calcium and a very healthy food. For those without the issues I mentioned, studies show milk can even be anti-inflammatory. So besides health benefits, it can help you in that way too. But if you're lactose intolerant or have milk-related issues, if you have symptoms, for example, I have a patient who says, I can't drink milk. We investigated, all tests were negative, but he really feels it. He drinks milk, rushes to the bathroom, gets diarrhea and bloating. In that case, it's best to avoid it, okay? Studies show that over 95%, that's 19 out of 20 people, have no issues with milk. So why do so many people online say otherwise? Because lactose intolerance cases do exist, and people often generalize from individual cases, trying to apply it to everyone, which isn't supported by science. So this info on the internet can be really dangerous. It takes isolated cases, like someone with lactose intolerance, and shows how bad milk is for them. Then people think everyone should avoid milk, but that's not true. There's no scientific evidence supporting the theory that milk is bad for non-intolerant people. Got it? If you're not intolerant, keep drinking milk. It's healthy and may even reduce inflammation. That's important news. You know, I always fight misinformation here. If you like this info, I'll continue, but please like and subscribe to the channel. Most people who watch this video, about 80%, aren't subscribed. They forget or put it off, so subscribe now and hit the bell to get notified when I post. Let's continue with our list. This food also causes a lot of bloating and retention. Processed meats like salami, coppa, turkey ham, Parma ham, salamito. These foods, besides preservatives linked to increased colon cancer risk like nitrates and nitrites, also have very high sodium content. I'll explain how this impacts your health and what amount is associated with cancer risk. These processed foods stimulate fluid retention in your body, which can cause bloating. Not just bloating, but also increased blood pressure and other health issues. If you eat it once a month when visiting family, that's fine. It won't cause all this inflammation and fluid buildup. Studies link the frequency of consumption to these health changes. So people who eat processed meats 3 or more times a week have scientific proof that it can increase cancer risk, especially colon and intestinal cancer. If you think about it, 3 times a week isn't much. If you're not careful, you might eat that amount or more. For example, ham. You eat a ham sandwich, then at a meeting there's salami, so you need to watch your processed meat intake, okay? Many people say, no, it doesn't cause harm. That's just fear-mongering, but no one's trying to scare you. Scientific evidence shows that eating processed meats more than 3 times a week causes these changes, plus excess sodium and body swelling. Number 4, alcoholic drinks. Alcohol can be very harmful to our body, especially when consumed in excess. And it's not hard to overdo it with alcohol, just like I mentioned with processed meats. 2 or more doses can already harm your body. Why did I say 2 or more doses? If you have any liver issues, like fatty liver caused by alcohol, then you'll need to cut it out completely. But generally, limit alcohol consumption as it can damage your digestive tract, cause various changes in your body, increase disease risk, and lead to bloating. It's best to stay away from alcohol. Number 5, another topic I want you to listen to until the end to fully understand is gluten. Is bread bad for you? Is wheat bread harmful? The same thing I said about lactose and milk applies here. Gluten will only make you sick if you have a gluten intolerance, celiac disease, or increased gluten sensitivity, where eating it makes you feel unwell. Scientific studies show that if you don't have any health issues, you don't need to cut gluten from your diet. You can keep eating it without increasing inflammation or causing diseases, despite many videos spreading false info about gluten. So why do so many people claim that bread is bad for you and that you should completely eliminate it? This gets a lot of views. People get scared and share the video. So this info, besides the example I mentioned of an isolated case where someone truly has gluten intolerance and gets sick from gluten, spreading it as if it's true for everyone, there's also the viewership issue. People who invent this know the video will reach more people due to the controversy. But relax. If you don't have celiac disease, gluten intolerance, or sensitivity, you can eat it without problems. It won't inflame your body, okay? These are scientific studies. There's no proof gluten is inflammatory for those without the conditions I mentioned. All right, let's continue. Did you like it? Are you smiling watching this? So, don't overdo it with bread or wheat flour. Too much can lead to excess carbs and bloating, but a slice or 2 of bread can easily fit into your daily diet. I love bread and eat it daily. It gives me energy for workouts and starts my day right. No false claims here. Number 6, sodas, sugary drinks, and chocolate milk. When you drink a sugary beverage, like a soda, you're ingesting a high glycemic index sugar without any fiber. This is apart from all the other preservatives and additives in soda, and there's much debate about the harmful dose. But I'm going to focus on the sugar here. If you consume excess sugar, as we've seen with added sugar, it causes 2 main changes in your body that can lead to bloating in addition to excess calories, which is the 3rd change. Obesity itself, as we know, fatty tissue has a metabolic effect and can produce substances that increase inflammation. So reducing calories and body fat can also help fight inflammation. It's one of the most effective practical methods. As I mentioned, cut sugary drinks out of your life, okay? I always share info without alarming you, but sugary drinks are unnecessary. Your body doesn't need those empty calories with no nutrients and lots of sugar. Now, what about 100% fruit juices? Can they really cause inflammation in your body? What's the deal with this? Why is there controversy about it too? When you make grape, orange, or apple juice, you remove fiber and end up with more concentrated carbs and a higher glycemic index. What's the glycemic index? It's how much a carb raises your blood sugar when you consume it. If it's just a bit of juice and you've no metabolic issues, you can drink it, no problem. But if you're diabetic or have changes like bloating, You should avoid these juices. If you have metabolic issues, it can make things worse. Juice won't cause diabetes, but diabetics need to be careful with grape, orange, and whole juices. They can lead to excess carbs and metabolic imbalance. Got it? See what I mean? Yeah, I'm telling you. I usually have about 3 or 4 glasses of juice a week. I allow myself this because I love orange and grape juice, but I don't have issues like diabetes. Number 7, fried foods. Avoid fried foods. Ever heard that lard is healthy or that coconut oil is healthy? It's all nonsense. These foods are packed with saturated fats and excess calories. They're loaded with unhealthy fats. This type of fat has been linked to increased heart disease risk. Got it? If you must fry, use olive oil. It's healthier and won't become harmful when heated. Your home stove won't exceed olive oil's smoke point. So saute veggies with olive oil, but skip lard and coconut oil. Those are high in saturated fats. Other fried foods like French fries, for instance, or fried chicken, right? You take healthy chicken and fry it, adding more fat to your diet. It's worth moderating or even avoiding these fats I mentioned, okay? I know it's tough, but occasional use won't hurt. Like before, don't make lard or coconut oil part of your daily routine. Number 8, another food to be very careful with is salt and sodium. You might have heard salt isn't bad or sodium can be good. I'm talking about excess here. But what counts as too much salt? The WU recommends up to 5 grams of salt or 2 grams of sodium. Studies show people in the US, Europe, and even Brazil consume 10 or more grams of salt per day. In some countries, this intake is even higher. So you've got to be really careful with salt. If you overeat salt occasionally, your body can compensate and eliminate the excess. But if you do it daily, and it's easy to overdo it. I'll give examples. You'll see how easy it is to hit 5 grams, not just by adding salt, but eating processed foods like instant noodles. 1 pack of instant noodles can contain about 70% of your daily salt needs. Some even have more, you know. Some are 100%, others more than 100%. So avoid foods with high salt concentrations. To avoid this, check food labels to see if they're high in salt or sodium. Don't just swap for spices. I love pepper, which helps me reduce salt intake as it seasons food well. What seasoning do you use to avoid salt in your cooking? Daily excess, like 10 plus grams, raises risks of high blood pressure and heart issues, plus fluid retention. So what are the causes? If you're eating right without excess, consider these 4 factors. They can cause swelling even when you're doing everything else correctly. The first and common cause, thyroid changes, particularly hypothyroidism. Untreated hypothyroidism causes swelling. Low thyroid hormone levels can lead to bloating. Thyroid tests include blood work for TSH and free T. These tests help doctors assess thyroid function and swelling causes. The second common issue is heart problems, like heart failure. A weak heart can't pump blood well, causing fluid buildup and swollen legs. There's a simple test called an echocardiogram. It estimates heart function, ejection fraction, and if it's causing the issue. The third cause is weak kidneys or renal failure. Kidneys regulate body fluids, eliminating or reabsorbing them. There's a simple blood test called creatinine. With this test, we can calculate the percentage of kidney function. The fourth cause is the liver, a crucial organ for our body. If it's not working well, called liver failure, you may experience swelling. Not just belly swelling, ascites, but swelling in other body parts too. Simple blood tests like bilirubin, prothrombin time, platelets, and albumin can reveal liver function, not just liver enzymes like AST and ALT that people usually check. These other tests better reflect liver function than the ones I just mentioned. Did you catch what I said about gluten and bread? Did you know there's a healthy way to eat bread? You've seen what I eat. I have tips to improve your health while still enjoying your favorite foods. In this video, I explain more about bread and healthy ways to eat it. Click here to be directed to the video. Take care. See you next time.